Good evening, and welcome to the final installment of our EKG boot camp. Tonight we'll be covering ectopic beats and the sinus arrhythmia.
Ninja Paramedic Guy, Ninja Paramedic Guy, Ninja Paramedic Guy. Medics rule. Ninja Paramedic Guy.
Accidents are the cause of trauma.
Ninja Paramedic Guy. Ninja
Rescue 804, arriving on scene.
Ninja Paramedic Guy.
We will not be using the graphing paper of science this time, as we've already covered the subjects that we need to cover. For the most part, this is just special considerations to keep in mind. Whenever you have a normal sinus rhythm that has an irregular beat, that is considered an ectopic beat. Now, examples of these ectopic beats are either PVCs, PACs, or PVCs, all of which relate to the rhythms we've already covered. All these beats are premature beats that are classified by the letter in the middle of each of their thing. The P and the C in all three of these names simply stands for premature contracture. The letter in the middle tells you where it's originating from. For instance, a PVC, the V is ventricular, so it's a premature ventricular contraction. So in this case, it's going to be an abnormal beat that is a ventricular beat. In other words, it looks like it belongs to the ventricular rhythm. A PAC is a premature atrial rhythm and will look like another sinus beat within the sinus rhythm that has a different pacemaker than the rest of the beats. A PJC, or a premature junctional contraction, will look like a lone beat of a junctional rhythm in the middle of your sinus rhythm. Now, when it comes specifically to PVCs, there are four terms that you need to be familiar with. The first term is bigeminy. This is when you're having a PVC every other beat. If you're seeing PVCs this often, it is often a bad sign. You need to check to make sure that the PVCs are perfusing. If they are not, the patient could be in imminent danger. The next term is trigeminy. This is when you're seeing a PVC every third beat. This is not as serious, however, it's something that you still need to look out for. You go up the next step to quadgeminy. That's one every four. Anything beyond that is just considered to be occasional PVCs. Now, going the opposite direction into having more PVCs than you do actual perfusing beats, you have, if there's two in a row, it's considered a couplet. If you have three in a row, it's considered a triplet. And anything four or more is considered a run of ventricular tachycardia. As a recap, PAC, PVC, PJC are all premature contractions of the heart that appear to occur as individual beats of whatever the rhythm they're named after is. Sinus arrhythmias are just when the heartbeat is irregular. Again, this is the final episode in our series on the EKG boot camp. We will not be covering EKGs again until we decide that it's time to cover 12-lead interpretation, and that will have its own unique series. We look forward to seeing you next time. If you enjoyed this video series or the video, please like, comment, share, and subscribe. And as always, until next time, see ya.